Right. And for the most part, you might have medication at 12 o'clock, and then this is for a 12-hour shift.
Mm-hmm.
And then by 6 o'clock, you give them their evening meds. Occasionally,
Mm-hmm.
you might have a patient who might need some restraints, which is
Mm-hmm.
not very often. They have a system where you call a code, and the hospital police comes, the doctor comes, other staff members come,
Mm-hmm.
and that's how no one person takes on a psych patient.
No, that's
No, we don't
challenging.
do
And
that.
yeah.
Yes.
So in terms of like the rooms, because if those patients, it's a psychiatric population we're dealing with, regarding the rooms, how are those rooms different from the regular, hospital room?
Oh, well, the psych floor in itself, it's different from it's a locked